Hey Dr. James. So this is my metacognitive reflection video. So the first thing I want to talk about is how I feel that I've changed by means of the specific domains of athletic training. Kind of the point of this assignment. So basically, to start off, when I look at injury prevention, I think about a PPE. In that area, I think about having a physician come in. We check blood pressure, we check heart rate. We might have an orthopedic station where we're checking ligament testing and kind of stuff like that. But never would I think of using a star excursion balance test in a pre-participation exam. Never would I think of using like a field test in a pre-participation exam. With the basketball team this year, I used the star excursion balance test with the anterior reach direction. And with that is a cutoff of 4 centimeters deficit between the two to determine an increased risk of lower extremity injury. With that information, I took it and I put it into an Excel document. I had all the guys' names in there. I created a couple different graphs that I was able to show my coach and kind of explain to him what the point of the test was, what the results showed, and what I'd like to do in the future. I told him that I wanted to take the athletes that were at a higher risk and incorporate them in an injury prevention type protocol or something like that. When I was in a high school setting during my undergrad, I did the pre-participation exam with the high school. It included an eye exam. It included, it actually used the best test. But the guidelines that they used for the best test, in my opinion, looking back, were not perfect. They were not standardized or evidence-based. I don't even know if they even used the information from the best test. I think that they just had it as a baseline for possibly for returning to play after concussion. Never once do I remember them using some kind of prevention protocol. And that preceptor, looking back, she was so burnt out on athletic training. She was bored with what she was doing. She was working in a high school setting. She was ready to get out. She said there was nothing else for her there. There are so many things that I've learned about throughout this last semester, especially in this class, that would motivate me every day in that setting and in the setting that I am now to do better and to improve. And it doesn't make sense to me how you could burn out at that point when there is so much that you can do in the future. A couple of the assignments that we did in this class involved us reflecting on our current practices for evaluation for certain regions. One thing that I was always super comfortable with was doing an ankle evaluation. During my undergrad, if I had an SP on ankle evaluation, it got in there, you saw that it was an ankle, boom, you knew exactly what to do. Let's do my 3 tests. This is what you got going on. End of conversation. When I did that reflective assignment, and I looked at all the articles that you had given us on the ankle and that are holistic in an approach, and it's looking more at just the evaluation, but also, well, it's looking deeper into the evaluation. So not just determining where the problem is, orthopedically or ligament-wise or muscle-wise. It's looking at the predisposing factors that played into it. It's looking at what deficits they have going on now after the injury. Do they have a reduction in range of motion? Is it because of a talar slide or a lack of talar stability? Is this their first time having an ankle sprain, or did they have chronic ankle instability but they just didn't know it? You look for these things throughout your evaluation instead of just figuring out an injury, putting a name on it, giving them a rehab plan that you've developed before, and calling it a day. Everything can be individualized, and when I look back on my practice, those first couple of weeks that I started, I was so overwhelmed with the amount of athletes that I had. It was football season. I had all these kids that needed my attention. I would treat them in whatever manner that I could. There was no treatment block or anything like that. I said, you go do this, you go do this, you go do this. Here, I'll show you how to do this. This guy's waiting, and this guy's waiting. Nothing was organized. When I would get done with my treatment, I would go back to my computer. I would look at my sportswear account, and I would have no idea where to start. And with that, I would hardly document anything. Now, when I have patients, which is every day, but when they come see me, they fill out a sign-in sheet. At that point, I will tell them, you have practice at 5:30. I want you to come back and see me at 4:45 because I have other people that need to get out to practice at 4:15, and that's when I'm going to treat them. So I'm going to treat them now, and I want you to come back and see me at 4:45. That way I can give you more attention. Another thing is CPRs, using them in my practice and acting on them. Not just having them in the back of my mind, but having them posted around in my supply room, so that every time I go in there and get supplies, I can look at and refresh my mind of what the specific auto and knee rules have, that I need to look out for and stuff like that. Before, it was whatever I could see on the spot. That's the direction that I went with my evaluation. There was no standardized guidelines to it. Finally, when I look at professional responsibility as a domain on here, I feel like it's my responsibility, especially being in this cohort, that I reach out to others that I know that are already in the profession. I reach out to those that may be getting to a point where they're burnout. Maybe those that are looking to use athletic training as just a stepping stone and they want to go into PT or PA. I have an old roommate that I'm always talking to about what we're doing, and it gets him so pumped. I'll send him an article that you put up in one of our modules, and I'll send it to him, and I'm just like, check this out. Like, this is a really good way to go about it. I feel like we're always trying to be so different and so individualized that we forget the basics and we forget to look out for these kinds of things. Like when I sent him the ankle evaluation algorithm, like, it just makes so much sense. But anyway, so I'm always talking to him, and he told me about his current roommate who's an athletic trainer with him, and he said he was looking to go PT, and he told him that he wanted him to call me and talk to me. And so that kid called me, and he's just like, hey man, I'm thinking about going PT. Like, I feel like AT is kind of a dead end. Like, I can't get to where I want to go in life if I just stick with AT. He's like, but Marshall told me to call you. He's like, so what you got? And I was able to talk to him for about 30-45 minutes about what we're doing, what we're going to be doing in the future, and how AT is so far from a dead end. If you are reflective with your practice, you will figure something out to do better the next day, every single day. Sorry, I just had something pull up. But so that's pretty much the extent of my reflection. But I think the biggest thing is my ability to reflect every single day and have it be meaningful, and figure out something that I can use or that I can improve on the next day, whether it's in my injury prevention, whether it's with my evaluations, my treatment plans for certain athletes, my documenting strategies, or anything like that. Communication, collaboration, everything along those lines. And I'm really putting together that everything is connected. So when I use an injury screening tool or something like that, I need to have a plan of what I'm going to do with that information. Just like I did with the anterior reach, what am I going to do with the soccer team? Am I going to use a specific protocol for prevention strategy if I find any increased risk of lower extremity injury? It's no longer going to be me being a reactive clinician waiting for something to happen. It's going to be me always looking forward and always looking ahead of what could happen and being prepared for it. Whether that's having new tools ready to use, whether on the sideline, new tools to use with my patients that are, not enthusiastic about their care. There's always something that I can do to improve. But I appreciate it, everything for this semester. Thank you.